Abu Bakr Muhammad bin Zakaria Ar-Razi, often known as Al-Razi or by his Latin name Razes, was a Persian physician, philosopher, and alchemist who lived during the Islamic Golden Age. He was born in Albay, a town of the southern slopes of Elbrus mountain near present-day Tehran, Iran, in the year of 865 AD, also known as 251 Hijrah. In his early education and experience, he showed interest in ability in a wide range of fields, studying and becoming accomplished in music, alchemy, philosophy, mathematics, and physics. At the age of 30, he stops his work and experiments in alchemy due to eye irritation from the chemical compounds he was exposed to. Among his discoveries in alchemy, he is credited with the discovery of sulfuric acid and ethanol. Then, Al-Razi studied medicine and probably also philosophy with Ibn Rabban, his teacher in medicine and also a physician and a philosopher. Al-Razi quickly surpassed his teacher and became a famous physician. He was appointed as a director of the hospital of his hometown Al-Ray during the reign of Mansur bin Ishaq ibn Ahmad ibn Asad of the Sasanian dynasty. He was called upon by Caliph Al-Muqtafi to be chief director of the largest hospital in Baghdad. Al-Razi was quite generous and charitable to his patients, treating them in a quite human manner, giving them treatments without charging them. The, the philosophical writings of Ar-Razi were neglected for centuries, and a renewed appreciation of their importance did not occur until the 20th century. Although he claimed to be a follower of Plato, his view differs significantly from those of later Arabic interpreters of Plato, such as Al-Farabi, Avicenna, which is Ibn Sina, and Averroes, which is Ibn Rushd. In his later years, he has a cataract in both eyes and become blind. He died in Al-Ray on October 27, 925, at the age of 60 years.
Actually, he is known for his encyclopedia of medicine and for his hard work of differentiating between smallpox and measles. His medical learning was first published under the title Kitab Al-Hawi, but it is well known in the form of Latin translation. At first, his work was quite argumentative, but for almost 3 centuries, his work served as the main source of Western therapeutic knowledge. His book also became an indicator in the development of the concept of specific disease establishment and the value of exactness of a disease. Some of his works such as Kitab Al-Hawi and Kitab Al-Mansuri as an everlasting fame in medical field. Ar-Razi was also the first in the Islamic medical tradition to write a book based on home medical. He used case histories a lot in his writing as an educational tool. He also suggested ways to deal with eye sickness. Al-Razi also made a huge contribution to neurology and neuroanatomy, where he describes about cranial, spinal cord and nerves. He was a colonizer in the treatment of mental illness. He established a special section for the treatment of the mentally ill. He is also considered the original portrayer of smallpox. He was the first to describe smallpox and to differentiate it from measles. The first monograph written was authored by Al-Razi, which consists 24 chapters dealing with various illness. Al-Razi pleaded for the use of honey as simple drug in compost medicines. His work to the scientific study of medical drugs include the introduction of Moody ointments. He also developed instruments used in pharmacies.
Abu Bakr Ar-Razi has long been honored as one of the greatest physicians of the Islamic world, as well as one of the most scientifically minded physicians of the Middle Ages. Here He described himself as a man who had always been moderate in everything except acquiring knowledge and in writing books. He claimed that he worked day and night and damaged his eyes and hands by writing over 2,000 pages in just 1 year. Many biographers state that Abu Bakr Ar-Razi became blind near the end of his life, probably because of his alchemical experiment. Although his colleagues urged him to undergo surgery to correct his loss of vision, the great physician told them that he was wary of seeing the world and he refused to undergo any medical or surgical treatments. But later, biographical accounts, however, generally claim that Abu Bakr Ar-Razi became blind after his patron Al-Mansur had the physician beaten on the head with one of his books, failing to provide proof of his alchemical theories. After traveling widely and mastering a broad range of subjects, including philosophy, music, poetry, and logic, Abu Bakr Ar-Razi became interested in medicine after a chance encounter with an apothecary in Baghdad. Thus, Abu Bakr Ar-Razi was already over 40 by the time he began to practice medicine, but he soon mastered the art and established a good reputation as a healer. Next, Abu Bakr Ar-Razi also joined a competition. In competition with hundreds of candidates, Abu Bakr Ar-Razi was chosen as physician-in-chief of one of the first major hospitals in Baghdad. Abu Bakr Ar-Razi selected the healthiest location for the hospital by hanging pieces of meat at various sites to find the site where there was the least putrefaction. Next, he also produced a book. Abu Bakr Ar-Razi books, a treatise on smallpox and measles, had become a landmark in the history of medicine. Therefore, Abu Bakr Ar-Razi treatise on smallpox and measles is a major landmark in establishing the concept of specific disease entities. According to the Abu Bakr Ar-Razi, smallpox was essentially a stage in the transition from infancy to adulthood, during which the blood fermented like wine. Abu Bakr Ar-Razi's book had a profound influence on the treatment of smallpox in Europe into the 17th century. According to he, the physician might lessen the virulence of the disease by proper management at the onset, but once the disease was established, the physician should encourage eruption of the spots by rubbing, steaming, purging, and bleeding. By differentiating between smallpox and measles, Abu Bakr Ar-Razi provided a paradigmatic case for thinking in terms of specific disease entities.
Ar-Razi also made significant contribution in the field of chemistry with the publication of Kitab Al-Asrar, the Book of Secrets, and Kitab Sir Al-Asrar, the Book of Secrets of Secrets. In these works, he gave several receipts for the alleged transmutation of common metals into precious ones, and crystal or glass into precious stones. Another Ar-Razi's main contribution to chemistry was his attempt to systematize laboratory practice, to which end he listed contemporary laboratory equipment and technique used in chemical experiments. Another influential contribution to chemistry was his classification of all the chemical substances he knew. Ar-Razi divided these substances into four main groups: vegetable, animal, derivative, and minerals. The last group consisted of 6 subgroups, which are spirits, metal, stones, tremens, boraces, and salts. And for your information, in later life, Ar-Razi has become blind, which according to some sources, his blindness was a result of torture and punishment given from Khalifah Al-Mansur when he failed to produce precious metals via alchemical transmutation. The historic contribution of Muslim scholars to the field of science and medicine are undisputed. Abu Bakr Muhammad ibn Zakaria Ar-Razi is considered among the pillars of the golden age of Islam. Ar-Razi is a truly unique and magnificent face of the Islamic civilization, rarely matched in history. He was a doctor, scientist, teacher, and humanitarian. He lived his life serving Islam, science, and humanity. He was extremely genius and ever ready to treat and help the poor. He known as the most appealing healer of his age. The more we learn about contribution and life dedicated to medicine, the more we value our Islamic cultural and scientific heritage. For centuries, his treatise, together with those of Avicenna's Canon of Medicine, was used as primary text for major medical schools in Europe. Commemorative stamps were issued by many centuries in honor of his work, and his portraits hang in the hall of the School of Medicine in Paris. There is no doubt that Ar-Razi was therefore one of the greatest physicians of Islam and the medieval ages.